Hello, fellow humans. I'm Zoe. This is my channel, Autistic Nana. Welcome. It's nice to see you. I'm going to be talking about the relationship between autism and ADHD today. When I got my autism diagnosis 21 months ago, a psychiatrist told me I should get assessed for ADHD. So obviously what I'm going to do then is I'm going to look into ADHD. I already knew my husband had it, but I wanted to know how it related to me because I didn't act anything like my husband. He's crazy. So I've been looking into autism and ADHD, and that's what I'm talking about today. And I want to pose the question, could ADHD be considered part of the autism spectrum? So there we go. I found a great site, neurodivergentminds.com. Dr. Neff has a brilliant picture, which I'll show you now. So this is the overlap between ADHD and autism. As you can see, there is a lot. So autism and ADHD are apparently two separate conditions. Until 2013, if you were diagnosed as autistic, you could not be diagnosed with ADHD. And if you were diagnosed with ADHD, you could not be diagnosed with autism. And there's a weird stat that I've seen online where autistic people are up to 80% likely to have some traits or an ADHD diagnosis, and ADHD people are up to 50% likely to have autistic traits. I don't know if that means that they are enough for an autism diagnosis, but I read it anyway. So that's where we are. In my head, it does beg the question, if you have both and you were diagnosed autistic first, that makes you an autistic person. But what if you got diagnosed with ADHD first? That makes you an ADHD person. So I find these stats really confusing. I love stats, but these stats really confuse me. So I'm assuming we have to go with the idea that an autistic person has predominantly autistic traits and an ADHD person predominantly comes across as an ADHD person, not an autistic person. But the traits cover each other up so well, it is kind of confusing. I got ChatGPT to make me a simpler picture than the one I just showed you. So let me see if I can find that. Okay, so this is what ChatGPT made me. And I specifically asked it to look at women and girls. So the overlap is sensory sensitivities, emotional dysregulation, executive function issues, masking, camouflaging, social difficulties, rejection sensitivity, and burnout, which is interesting. So it is difficult. I'm going to get assessed for ADHD. I still don't know if I think I have ADHD. I still am confused about what makes women and girls ADHD. Anyway, I don't know. So the more I've looked into it, the more I've decided that autism and ADHD have so many things in common. I thought I would have a look at whether the brain can tell us anything. So there's been lots of people that have had brain studies done, and there seems to be a lot of overlap in that area as well. So on a brain scan, there are areas that are affected with autism and there are areas affected with ADHD. And there is a load of similarity there as well. Let me have a look, see if I can find a picture. So looking at the overlap again, you can see that sensory sensitivities overlap, executive function struggles overlap, and processing social situations has some overlap. Brain scans also show these overlaps. So it's not just traits. It's not just traits we're talking about. It's shared brain wiring. So you'll have to forgive me while I read this bit because I did a bit of research. I haven't memorized it all. I'm going to have to put me proper Nana glasses on now. So hold on a moment. Okay, right. So there's shared symptoms and overlap, okay? But they don't always manifest in the same way. So I think this is quite important. So if we look at the symptom area of attention and focus, in an ADHD person, they'll be inattentive or easily distracted. Maybe I might be one of those. I'm not sure. In an autistic person, they may hyperfocus or ignore stimuli. So that is definitely true. So the shared characteristic here is an atypical attention regulation. Okay? Right. In social interaction, ADHD may have impulsive or poor turn taking. Autistic people, social withdrawal, difficulty with cues. Okay, so the shared characteristics here are social communication challenges. Executive functioning. Okay, ADHD, disorganized, forgetful. Autism, difficulty with planning and flexibility. So they're the shared characteristic. Executive dysfunction. Symptom area, hyperactivity, impulsivity. ADHD, fidgeting, impulsive behavior. Autism, anapia, hyperactive or rigid. The shared characteristic then is difficulty with self-regulation. Okay, so an autistic person might be stimming. An ADHD person might be jiggling their leg, which could be considered stimming, surely. Okay, next bit. Sensory sensitivities in ADHD, they are sometimes present. Okay, my husband does moan about noises a lot. He's ADHD, so, in autism, these are very common. The shared characteristic is atypical sensory processing. Okay, so that's your overlap. There are neurobiological and genetic links. Both conditions have a strong genetic component. As we saw earlier, that was 50 to 70% genetic component. Shared heritability. Some gene variants related to dopamine transport and synaptic development are associated with both autism and ADHD, which is interesting. Brain structure function. Neuroimaging reveals both disorders may involve abnormalities in the prefrontal cortex, the basal ganglia, the cerebellum, and default mode network. Differences in white matter connectivity and dopaminergic systems are also seen in both. Cognitive and emotional differences. Both ADHD and autism have executive functioning deficits, as said before, e.g. working memory, planning inhibition, emotional dysregulation, outbursts, mood swings. Theory of mind difficulties. So it's more pronounced in autism, but it can be hard to work out what other people are thinking or feeling, especially when you don't understand body language. ADHD individuals are more likely to externalize their behaviors, and autistic individuals are more likely or are viewed as internalizing the symptoms. Obviously, this is a generalization. It doesn't apply to everybody. Diagnosis and differential challenges. Diagnosing one disorder in the presence of the other is complex. I think we've established that already. I think when you're experiencing it, you can't even diagnose it in yourself. So I don't know how somebody's supposed to work it out from the outside, but I guess that's their job and that's what they're trained in. Okay, so there are medicines for ADHD. There aren't medicines for autism. So if you've got ADHD, you might be offered stimulants. I don't think autistic people can tolerate stimulants very well. So if you do have both and you want to try and treat the ADHD, that might make it a little bit difficult. You can take medication if you've got autism and it causes anxiety, but that's an anxiety medication. Yes, functioning and life impact. That's an interesting one that I looked up earlier. Greater functional impairment than those with either condition alone. So that's good to know, isn't it? Higher risk of academic difficulties, social isolation, bullying, and mental health issues. Depression and anxiety. Here we go again. So there's a need for multidisciplinary support. So therapy. Then you have to go somewhere new and speak to a stranger. Have a problem with that. Educational accommodations while you're at school. Well, I'm old. We didn't have things like that when I was at school. So there you go. Vocational training. I think that is a good one, actually, especially for ADHD people. If they can do a vocational training course. If that had been around when my husband was young, I think he would definitely have benefited from that. Unfortunately, at that point, Margaret Thatcher had taken that away, so he didn't have that option, unfortunately. Some researchers propose that ADHD and ASD exist on a neurodevelopmental continuum, not as entirely separate categories. That was my theory. I thought I made that up. I didn't make that up. People are looking into it already, apparently. Others highlight the importance of maintaining distinct diagnostic labels. Okay, so there's a bit of a disagreement there, but, what can you do? Emerging areas are the role of environmental factors, RFK Jr. will love that, and neurodiversity movement perspectives which promote acceptance and support over pathologization. There you go, it's a word. Clinical implications, early and accurate diagnosis is essential to tailor interventions. Okay. Early and accurate diagnosis. I don't think that really counts when you're 54, does it? No. And actually, if I do get an ADHD diagnosis, that'll be a week before I'm 56. I don't think that counts as early, accurate diagnosis either. Individualized treatment plans. That doesn't exist when you're an adult, does it really? Careful monitoring to avoid over or underdiagnosis, especially in girls, ethnic minorities, etc., etc. So that's what I wanted to add there. Thanks ChatGPT for doing my research for me. Brilliant. Anyway, let's continue talking about it is shared brain wiring. So as you can see, there's a lot of overlap, which is adding to my confusion, shall we say. If you are interested in this topic, and I'm not doing that great a job of it, I can recommend that you go to the website neurodivergentminds.com. Dr. Neff does an amazing job of explaining all this. I'm going to refer to one of her diagrams again now, so hold on a moment. And here's her other diagram. So she actually shows the percentage overlap range between 22 and 83%, which is a really big. So I think we can see from looking at this, there is a huge overlap, and it makes a lot of sense that in 2013, they changed the DSM to say that you could have a dual diagnosis. So the term AuDHD has been created to encompass a dual diagnosis of ADHD and autism. There's a huge amount of genetic factors listed. So the estimate here is 50 to 72% overlap of genetic factors. As I say, I don't know where they get these stats from, and these stats are so broad ranging, it makes it really difficult to answer the question, is ADHD truly a separate condition from autism? I mean, I'm sure there are lots of people out there that think they just have ADHD, and I'm sure they do just have ADHD. But are there bits of their traits that actually could be diagnosed as autism? Truly confusing subject, this. So in both cases, the brain is wired differently, but the brains aren't wired differently to each other. There is a large amount of overlap with the brain wiring. People that do have an autism diagnosis can, like me, feel that it doesn't explain everything, because it doesn't explain everything. I have a lot of hobbies on the go, and I flip from one to the other. And my true autistic focus is animals, especially my tortoises. I've got a lot of tortoises. I've got over 50 tortoises. So you could consider that to be a special interest. And that special interest has been lifelong. We had a tortoise when I was a kid growing up. And when I moved out, I got tortoises of my own, and it just went from there. But I have hobbies that I go for. I go for a phase of reading a load of books. I'll go for a phase of doing a lot of crochet. I have crochet behind me. I'll go for a phase of doing sketching. I'll go through a phase of painting. I suppose that is technically different to sketching. I'll go through baking phases. As a kid, I used to make candles. I've always collected rocks and crystals. There's all these other things on the go, not just the special interest of animals. So yeah. And I don't have just the one special interest. I've also got a special interest in Japan. And that goes back to when I was a teenager, and possibly before that, because my uncle always did karate, and I always found that fascinating. And I knew karate was from Japan. Yes, I don't think I'm just autistic. I mean, I'm going to find out in 2 days' time. I don't really know why I'm having this discussion now. I'll probably have to have another discussion afterwards. But are they different things? Maybe I should ask the psychiatrist on Monday. I might do that. Anyway, let me know your thoughts. Do you think autism and ADHD should be categorized completely separately? Is there enough overlap to warrant them being considered part of the spectrum, the color wheel? Are they just different parts on that image? So there's some traits over here that are autistic and some traits over here that are ADHD, and could they be incorporated into one colour wheel? I don't know if anyone's done that. I might have a look for that as well. I'm very interested in this topic. I don't know how it's all going to turn out. I don't know if there's neuroscientists looking into this as I'm speaking to you now that can give us some answers, because I'd really like to know the answer to this question. Put your thoughts below. Thank you for putting up with me. I'm sorry for the rambling, but Autistic Nana does ramble, and I can only apologise about that. Maybe that's a sign of ADHD too. Anyway, take care. Hope to see you again. Goodbye.